reach for so many Americans would become a distant dream. I yield back.
Sorry. Chairman from Minnesota is recognized.
Mr. Speaker, can I inquire as to the time remaining on each side?
Gentleman from Minnesota has 17 minutes. The gentleman from New Jersey has 16 and a half minutes remaining.
Thank you, Mr. Speaker. I'm now pleased to yield 2 minutes to the gentleman from Virginia, Mr. Goodlatte.
Gentleman from Virginia is recognized for 2 minutes.
I thank the gentleman from Minnesota, the chairman of the Education Workforce Committee, for yielding me this time and for his leadership in combating this terrible bill in the aftermath of a very disappointing Supreme Court decision ruling that sometimes what we all thought and were told was a penalty is now a tax, but sometimes it's not a tax, it's a penalty. First time in the history of the United States Supreme Court in over 200 years of decisions that a device has been called both a penalty and a tax at the same time. Very disappointing, and here's what it leaves American citizens with. This is your new health care system, more than 150 new government agencies and programs. I was called by PolitiFact a couple of months ago, and they said, where do you get that 150 new government agencies and programs? We sent them a list of 158 new government agencies and programs with the page number of the bill and the section number of the statute, and we've never heard back from PolitiFact. I'm disappointed. I thought we were going to see one of those arrows pointing all the way over to the far right saying true, and it is true. Not only do we get 150 new agencies and programs, we get 400 new authorities for the Secretary of Health and Human Services and other bureaucrats here in Washington to dictate to families and businesses large and small, the local governments and state governments, to insurance companies, to health care providers, what your insurance policy is going to look like, which means you won't be able to keep the insurance that you like now and that you were promised you could keep by the President once upon a time. No, no sirree. We already have 12,000 pages of new regulations that have been written, and they haven't even covered about half of those 400 new mandates, new regulatory authorities that they can write regulations on. It's going to cost $2 trillion over 10 years, $500 billion in cuts to Medicare, over $800 billion in new taxes, including $250 billion in taxes on middle-income Americans. And the fact of the matter is, this monstrosity needs to be repealed. Vote for this legislation and repeal it today.
Gentleman from New Jersey is recognized.
Mr. Speaker, I yield myself 30 seconds.
Gentleman is recognized.
2 points with respect to my friend for Virginia's comments. This tax, once again, 97% of American families don't pay a dime more in taxes here. It's families with a gross income in excess of about $300,000 a year, and people who can afford health insurance opt not to buy it and send their neighbors the bills. And these regulations my friend talks about, here's what one of the regulations says. If your health insurance company, which doesn't really have to compete for your business because they have a monopoly or oligopoly, doesn't spend money on your premiums, at least 80 or 85%, they have to give you the money back as a rebate. This summer, millions of American families, I would ask for 15 more seconds.
Gentleman is recognized.
This summer, millions of American families will be getting rebates from their health insurance companies because they haven't spent their money on care, they spent it on profit and overhead. We don't think that's such a bad regulation. Mr. Speaker, in the interest of time, I think my friend the chairman has more speakers than we do, so we're going to have them go 2 for our 1 to kind of keep it even, if that's okay with my friend the chairman.
I appreciate my friend having me do that, and we're glad to comply, Mr. Speaker. So at this time, I'm pleased to yield a minute to another member of the committee, the gentleman from Pennsylvania, Mr. Thompson.
Thank you, Chairman.
Gentleman from Pennsylvania is recognized.
Thank you, Mr. Speaker. Prior to Congress, I spent nearly 3 decades as a professional in a nonprofit health care setting. In health care, there's a saying, do no harm. Unfortunately, Obamacare violates this principle. The President promised his plan would decrease annual premium rates for the average family. They've actually increased. The law creates an employer mandate that provides a perverse incentive for companies to drop their employees from health plans. The law wastes money on so-called demonstration programs in order to conceal the law's scheduled cuts to Medicare Advantage, a blatant attempt to isolate the President from the political fallout from our nation's seniors in November. The administration insisted that failure to comply with the individual mandate would not result in a tax. Well, it's official. It's a tax. The American people are fed up. Why? Another check was written that cannot be cashed. More promises were made that cannot be kept. Mr. Speaker, we must protect the American taxpayer. We must prevent this policy from doing more harm. We must repeal this law. Now yield back.
Gentleman yields. Gentleman from New Jersey is recognized.
Speaker, I yield myself 20 seconds.
Gentleman is recognized.
My friend from Pennsylvania just made reference to the employer mandate. It's very important that the public know and the members know that if a business has 50 or fewer full-time employees, 50 or fewer full-time employees, what they have to do under the Affordable Care Act is nothing. There is no mandate of any kind for a business with fewer than 50 full-time employees. I'm pleased at this point to yield to a gentlelady who fought hard for senior citizen rebates on prescription drugs, a gentlelady from Cleveland, Ohio, Ms. Fudge, for 2 minutes.
I thank you. I thank the gentleman for yielding.
Gentlelady from Ohio is recognized for 2 minutes.
Thank you so much, Mr. Speaker. I strongly oppose H.R. 6079. Republicans in Congress need to stop the political grandstanding, stop wasting this House's time and the taxpayers' money, and start doing the work we were elected to do. There are critical issues facing the American people that desperately need our attention. The middle class is asking Republicans, where are the jobs? And what is their plan to stop outsourcing American jobs? We should and we must focus on legislation in this House that will strengthen our economy. Yet it seems like Groundhog Day, the same thing over and over and over again. The American people should know what it's going to mean to repeal the Affordable Care Act. Let me tell you what it means. It means that the Republicans support legislation that will make insurance company CEOs and executives richer. It means that Republicans support legislation that will deny the right of young adults to remain on their parents' insurance until age 26. What it means is that the Republicans support legislation that will deny individuals with pre-existing conditions the right to affordable health care. It means that Republicans support legislation that will raise prescription drug costs for our seniors and eliminate provisions that hold insurance companies accountable for double-digit premium increases. It means that Republicans support legislation that will raise the taxes of hundreds of thousands of small businesses by eliminating the small business health care tax credit, which helped them afford health insurance for more than 2 million workers. And just for the record, the Washington Post fact checker has also concluded that and I quote, the health law will provide more tax relief than tax burden for the middle class families, end quote. Again, it says, quote, the health law will provide more tax relief than tax burden for middle-class families, end quote. This repeal would mean that Republicans support legislation that will prevent eligible constituents from receiving the same health care coverage as members of Congress. And I'm not sure why Republicans can feel that their constituents do not deserve the same access that they enjoy themselves. But by voting to repeal the Affordable Care Act, that is exactly the message being sent to the people we represent. I yield back.
Gentlelady yields back. Recognize the chairman from Minnesota.
Yeah, thank you, Mr. Speaker. I'd like now to yield 2 minutes to a member of the committee, the very distinguished gentleman from Tennessee, Dr. DesJarlais.
Thank you, Mr. Chairman, and thank
Gentleman
you,
from
Mr. Speaker.
Tennessee is recognized.
I come to the House floor today to call attention to yet another problem in this poorly drafted 2,700-page job-killing bill. We all remember former Speaker of the House, Nancy Pelosi's famous statement that they needed to pass the bill so we could find out what was in it. Today I stand here perplexed by not only what is in the bill, but also what is not in the bill. When drafting Obamacare, Democrats only gave authority for the IRS to offer premium tax credits to state exchanges. While many states are refusing to set up these exchanges, making it necessary for federal government to create them. That is permissible within the law. Here is what is not. Nowhere in the law does it give permission for those credits to be offered in federally run exchanges. Mr. Obama, having recognized his grave mistake, has circumvented Congress by having the IRS unilaterally change his bill to fix this error. Last time I checked, it was Congress that made laws, not the executive branch. The legislative process should still have meaning in this country, which is why my colleague and fellow Tennessee physician, Dr. Phil Rowe, and I recently introduced legislation which prevents the administration from rewriting the law. Even my colleagues who support the President's law will surely agree that his administration's actions lead us down a dangerous constitutional path. My opposition to Obamacare is clear. That aside, having a President act without Congress to change law sets a dangerous precedent, one that violates the principles of our Constitution and the separation of powers, principles that are the pillars of our democracy. And I yield back.
Gentleman yields back. Gentleman from New Jersey is recognized.
Mr. Speaker, I yield myself 15 seconds.
Gentleman is recognized.
My friend's comments echo ones we've heard for the last 2 years about the unconstitutionality of the law. The Supreme Court spoke with great authority to that question. People may agree or disagree with the policy, but this law is clearly constitutional and valid. I'm pleased at this time to yield to the author, the originator of the employment discrimination provisions against pre-existing conditions. Gentlemen who really initiated that. Gentleman from Connecticut, Mr. Courtney, for 2 minutes.
Gentleman from Connecticut is recognized for 2 minutes.
Thank you, Mr. Speaker, and thank you, Mr. Andrews, for your leadership in this debate here this evening. We've heard a lot of misleading comments about the so-called damage that has been done to U.S. employers as a result of the Affordable Care Act. Well, the people who make those statements forgot to ask the 5,200 American employers who stampeded into the Affordable Care Act's early retiree reinsurance program. Over half of the Fortune 500 companies in this country included in that group, some of whose corporate logos are in the chart here. And rather than causing problems with new employment, again, just looking at Ford Motor Company, they've added 7,000 workers this year to the ranks of their assembly plants, obviously using the benefit of the early retiree program, which acts as a federal backstop for high insurance claims, a principle and a pattern that we have used for flood insurance, that we've used for nuclear power plant insurance, again, using the federal government as a backstop for high-cost claims. And again, companies like Comcast, who are hiring in my district, have all taken advantage of this program. Individuals who make these claims have also forgotten to ask the 360,000 small businesses that last year took advantage of the small business tax credit, a 35% tax credit on health insurance premiums. That number is going to go up to 50% starting in 2014. And as Mr. Andrews has repeatedly pointed out here tonight, there is no mandate on businesses or firms 50 or less. That's 96% of small businesses in America, but there will be a tax credit to help those firms actually defray the cost, because as a former small employer myself, small employers want to provide benefits. The problem is that they have trouble affording it, and the tax credit set up in the Affordable Care Act will help those small businesses defray the cost and entice and enroll new employees in their businesses who are looking for those types of benefits. So the fact of the matter is that with the job growth that we have seen, again, we need more, but with the job growth over the last year and a half since the Affordable Care Act went into effect, we have helped businesses, 5,200 employers who are using the early retiree insurance programs, including nonprofits, religious institutions, and public sector employers across the country, and 360,000 small businesses who've taken advantage of that tax credit. We need to build on that success and grow this economy. Let's skip this debate and move on to real jobs legislation. I yield back the balance of my time.
Gentleman from Connecticut yields back. I recognize the chairman from Minnesota.
Thank you, Mr. Speaker. Before I yield to Dr. Bucshon, I'd like to yield myself 30 seconds. We've heard a couple of times today from my distinguished friend and colleague from New Jersey and again from the well about how small employers are affected by this. If you have 50 or fewer employers, you have to do absolutely nothing. But of course, if you have 51, if you hire just one more employee, you have to pay $42,000 in penalties, I mean taxes, or whatever that is after the Supreme Court ruling. It's having an impact on our employers. There's a reason why they're not hiring. There's a reason why they're scared. And there's a reason, frankly, why they want us to repeal this awful piece of law. I'm now pleased to yield 2 minutes to a member of the committee, a physician, the distinguished gentleman from Indiana, Dr. Bucshon.
The gentleman from Indiana is recognized for 2 minutes.
Thank you, Mr. Speaker. I rise today to urge my colleagues to support repeal of the Affordable Care Act. It's ironic that this legislation is called affordable because in my home state of Indiana, it will be anything but affordable. What's in it? How about 21 new taxes, most of which hit the middle class? The law has generated and will continue to generate thousands of pages of regulation to comply with, and establish taxpayer-subsidized exchanges that are predicted to be overwhelmed when employers start dropping their private policies for their employees. Paying the penalty will just be more cost-effective for these employers. In Indiana, there will be approximately 500,000 additional Medicaid enrollees in 2014, and by 2024 there will be approximately 700,000 additional enrollees compared to today. Medicaid is already a broken, financially strapped program that does not provide good insurance coverage for its beneficiaries. Why would we use Medicaid as the vehicle to provide coverage? Access to physicians will continue to be a significant challenge as fewer and fewer physicians take Medicaid. The additional cost will be $2.5 to $3.1 billion to Indiana's Medicaid expenditures. Once the federal subsidies end, state taxes will have to be increased dramatically, or more likely reimbursement to providers, hospitals, and physicians will need to be cut. This will result in further access issues for beneficiaries as even more doctors drop out of the program. As the number of Indiana residents depending on the exchanges for their insurance grows, the cost to the federal taxpayer will grow rapidly. Either taxes will have to be increased, or again, more probably, reimbursement to providers will be cut. We now have a new group of citizens, many of which who previously had private health coverage, that are dependent on a government program that is financially strapped. Access to providers will begin to become an issue. The ACA is a financial snowball rolling down the hill. We must repeal it before it's too late. We need step-by-step, patient-centered health care reform that decreases the cost while maintaining the access to and quality of medical care in this country. I yield back.
The gentleman from Indiana yields back. The gentleman from New Jersey is recognized.
Mr. Speaker, I yield myself 20 seconds.
The gentleman is recognized.
The gentleman from Indiana just said that this would be where taxes would hit the middle class. I wish that were true in some ways, because the people this hits are people with a household income of over $300,000 a year. I wish more people in the middle class made more than $300,000 a year, but they do not. And then secondly, with respect to Medicaid enrollees, for the first 3 years, the Federal Treasury picks up 100% of that cost. 10 more seconds, I yield.
The gentleman is recognized for 10 seconds.
And thereafter, the average is about 95% of the cost of the new enrollees. This is a benefit to state governments, and I predict that virtually all of them will opt to join in. At this time, I'm pleased to yield 1.5 minutes to a gentleman who understands the impact on hardworking families being able to get affordable health care in this country. The gentleman from Missouri, Mr. Carnahan, for 1.5 minutes.
The gentleman is recognized for 1.5 minutes.
Thank you, Mr. Speaker. I oppose the Republicans' attempt to repeal the new health care law. When people in St. Louis go to work, they want to pay a fair price for a day's work. They want fair pay for a day's work. When they buy dinner on the way home, they expect to pay a fair price. They don't expect to get gouged because the chef needs a new set of golf clubs. But that's an example of what's happened in the health care industry. Private health insurance premiums are rising faster than Medicare costs to provide the same services. Bonuses, advertising, overhead have crowded out dollars for actual health care. The Affordable Care Act, or the ACA, changes that. Now, by law, 80% of private insurance premiums must be spent on paying for health care. Some companies cannot or will not lower overhead and profits to 20%, so this year they'll be forced to pay refunds, more than $170 on average, to more than 580,000 residents in my state of Missouri. So, Mr. Speaker, for those who have stood up for health care today, I stand with them. The Republican idea is to go backward to the broken system of the past. They're trying to end insurance for kids with pre-existing conditions, end protection from prescription drug costs, end free mammograms, end affordability tax credits for small business, end refunds from insurance companies that don't spend enough on health care. Let's call this Republican repeal bill what it is. This is a distraction from addressing the jobs agenda of this country. Let's get past this Republican stunt. Let's get back to work on things we can do together to continue to grow this economy.
The gentleman from Missouri yields back. The chairman from Minnesota is recognized.
Thank you, Mr. Speaker. Could I inquire again as the time remained on each side?
The chairman from Minnesota has 10 minutes remaining. Gentleman from New Jersey has 9 1/4.
Thank you, Mr. Speaker. I'd now like to yield 1 minute to a member of the committee, the distinguished gentlelady from South Dakota, Mrs. Nome.
Gentlelady from South Dakota is recognized for 1 minute.
Thank you. I thank the gentleman for yielding. And, Mr. Speaker, I rise today to support this bill, which would repeal the President's health care law. We've known all along that this bill will cut $500 billion out of Medicare. We've known all along that up to 20 million Americans could lose their employer-sponsored health care coverage. And we've known all along that this health care law has only made costs go up rather than go down and decrease since its passage. However, we now know that buried within the 2,700 pages of this bill is yet another tax that is going to hit and fall on the middle class. This is in addition to the nearly 24 tax increases already in the law on everything from over-the-counter prescription medication to pacemakers. The American people were giving a laundry list of promises, but it has turned out that very little of what was promised turns out to be true. We owe it to every taxpayer, to every senior, and to every American to repeal this law and pass real solutions that don't put Washington in charge of our health care. And with that, I yield back.
Gentlelady from South Dakota yields back. Gentleman from New Jersey is recognized.
Mr. Speaker, I yield myself 20 seconds.
Gentleman's recognized for 20
The
seconds.
gentlelady just talked about cutting $500 billion from Medicare. The fact is that the Affordable Care Act extends the life of Medicare for 8 years. It adds benefits for seniors, and more interestingly, the cuts that were made, which take corporate welfare money away from insurance companies and avoid waste, were voted on in favor by every Republican who has spoken today, because every dollar of those cuts were used in the last 2 Republican budgets. At this time, I'd like to yield to a gentleman who's been a leader in health care for a long time, who understands just how much his district has benefited from affordable health insurance, my good friend from California, Mr. Farr, for 1.5 minutes.
Gentleman from California is recognized for 1.5 minutes.
Thank you, Mr. Speaker, and thank you for yielding. I've been listening to this debate, not just this moment, but throughout the whole health care debate, and it just kind of shocked me. Why are the Republicans so angry with a bill that essentially they wrote? It was the Republicans who wanted to mandate that every person in the United States carry private health care insurance. Well, the bill does that. It was the Republicans who wanted to make sure that people who were cheating on Medicare got busted. No free ride. The bill does that. It was the Republicans who said people ought to help themselves by being healthier, eating better, taking care of your health, and exercise more. The bill encourages that. So why is a bill that has so much Republican writing in it, why are they so angry about it? And it struck me. Remember at the beginning of this year, they said, we want to defeat the president no matter what, even if he signs into law our ideas. That's it. He signed into law an awful lot of Republican ideas, and they can't stand it. Now, I want to tell you is don't listen to the rhetoric down here. Go check for yourself. You can go to www.healthcare.gov. Go to your state, go to your county, put in some information about yourself. Find out for yourself. Check the facts. It's there. It'll tell you what you get and what you don't get. Look it. There are so many good things that this bad repeal is trying to do. It's going to take away affordability. It's going to take away access. It's going to take away what Americans have been asking for over 100 years. Let's keep it. Let's make it work. Thank you.
Gentleman from California yields back. The chairman from Minnesota is recognized.
Thank you, Mr. Speaker. I'd now like to yield to another member of the committee, the gentlelady from Alabama, Mrs. Roby, 2 minutes.
The gentlelady from Alabama is recognized for 2 minutes.
I thank the chairman for yielding. And, Mr. Speaker, I rise today in support of H.R. 6097, the repeal of Obamacare Act, of which I'm a proud co-sponsor. And, of course, on March 23, 2010, President Obama signed into law the largest health care overhaul in the history of the United States. And sadly, it is less about providing quality health care for all citizens and more about expanding the scope of federal government. And the law failed to address the #1 health care concern that families and employers have, and that's cost. And under the individual mandate, as I've sat here and listened to the debate, each individual absolutely will be penalized or taxed. We'll call it a tax because the Supreme Court did. If in America, this free country, that person chooses to remain uninsured or purchase health care that is not government approved, and that is regardless of their income. Despite the Supreme Court's ruling, a significant number of Americans continue to oppose Obamacare, and they are encouraging Congress to take immediate action. Americans and their doctors, not federal bureaucrats and politicians, are in the best position to determine which health care options best meet their individual needs. Regardless of the Court's decision, many problems within the law remain present, many of which have a significant impact on small businesses. The American people do not want a one-size-fits-all health care system that imposes numerous mandates, regulations, and tax hikes on employers and employees. This will be devastating not just to my home state of Alabama, but also to the nation. And I look forward to working with my colleagues on both sides of the aisle to improve our health care system by implementing market-based reforms that actually lower costs, increase access, and maintain high quality of care for all Americans. I urge my colleagues to listen to the voices of the American people and support H.R. 6097. Thank you, Mr. Speaker, and I yield back.
Gentlelady from Alabama yields back. The gentleman from New Jersey is recognized.
Mr. Speaker, I would yield myself 15 seconds.
Gentleman's recognized for 15 seconds.
My friend from Alabama, in describing the individual mandate, which Republicans have supported for years, said that it's imposed irrespective of income. That's not accurate. If you're on Medicaid, the mandate, of course, is covered by Medicaid. There's also a hardship exemption for someone who can demonstrate that they can't afford it given the subsidies, and there's also a religious conscience exemption as well. At this time, I'd like to yield to a gentleman who worked very hard to make sure that small businesses and entrepreneurs were aided by this bill and not hurt by it. The gentleman from Colorado, Mr. Paulus, for 2 minutes.
Gentleman from Colorado is recognized for 2 minutes.
Thank you, Mr. Speaker. In this bill before us today, there are several provisions that I think the American people would be very angry and will be very angry when they find out what this body is up to. In this bill before us today, members of Congress would be able to maintain their government-subsidized health care after they retire, instead of getting insurance from a plan created under the Affordable Care Act like everybody else. Now, before the Affordable Care Act was passed, members of Congress were eligible to continue to receive government-subsidized health insurance under the Federal Employees Health Benefits Program even after they retired. This bill before us today would return that benefit, would give government-subsidized health insurance to members of Congress, even as it took it away from millions of other Americans. Members of Congress should not have access to special health insurance plans paid for by American taxpayers, as the Republicans would have us do under this bill. In addition, this bill would increase the deficit. Now, we don't know by how much. Could be $143 billion, could be $230 billion. The issue is we won't even have that estimate until July 23rd. Now, once we have that estimate, it should be important for the Republicans, if they intend to modify this bill, to say how they're paying for it. Be honest with the American people. Are the Republicans in favor of increasing the deficit by $150 billion at the same time to give lifetime retiree health care benefits to members of Congress? Or do the Republicans intend to pay for this repeal by increasing taxes on the American middle class? I urge a no vote on this Republican bill to give benefits to members of Congress and to raise taxes on the middle class, and I yield back the balance of my time.
Gentleman from Colorado yields back. Chairman from Minnesota is recognized.
Mr. Speaker, now I yield 2 minutes to another member of the committee, an emergency room physician, the very distinguished gentleman from Nevada, Dr. Heck.
Gentleman from Nevada is recognized for 2 minutes.
Thank you. I thank the Chair, and thank you, Mr. Speaker. Just because a law is constitutional doesn't mean it's a good law. And just because a law is well-intentioned doesn't mean that it fulfills its promises. Now, as a physician, I've heard firsthand from patients who have serious concerns about the so-called Affordable Care Act that it would actually reduce access to affordable, high-quality health care by enacting substantial new taxes, creating thousands of pages of new regulations, and most alarmingly, putting unelected, unaccountable government bureaucrats in between patients and their doctors. Millions of Americans were assured that if they liked their health plan, they could keep it. Yet, our committee has heard testimony from businesses large and small that the increased cost of providing health coverage for employees is simply unsustainable. I've talked with business owners in my own district that want to continue to provide coverage for their employees, but the health care law is making that harder. These so-called small business tax credits phase out so quickly after you get above 10 employees or you start to increase wages that it's a disincentive to grow a business. Further, the Supreme Court's ruling highlights an uncomfortable truth for the law's supporters. This law stands only because the individual mandate is considered a tax, even though proponents repeatedly insisted it was not. Mr. Speaker, we were told Congress had to pass the bill to find out what was in it. Well, what we found was a bait and switch of unprecedented proportions. I strongly believe that we should ensure that patients with pre-existing conditions have affordable insurance options, that annual or lifetime limits don't prevent Americans from receiving the care and treatment they need, and that young adults have access to insurance, especially in difficult economic times. That's why I've introduced replacement legislation to do exactly that without a government takeover of the system. We need to repeal this law and move forward with reasonable, bipartisan, patient-centered reforms that restores the government to its proper role in our health care system and ensures that our patients, their families, and their doctors have the ability to decide what care is most appropriate. It's for those reasons that I strongly urge support of H.R. 6079. I yield back the balance of my time.
The gentleman from Nevada yields back. The gentleman from New Jersey is recognized.
Mr. Speaker, I yield myself 30 seconds.
The gentleman's recognized for 30 seconds.
Mr. Speaker, we've done some research and have been unable to find any occasion in the recent history of the House where a major piece of legislation has been brought to the floor where the Congressional Budget Office has not yet scored what it's going to cost. I think it's very important that members understand this. No one can tell the members of the House how much this repeal will add to the deficit. No one. When the first repeal came up in January of 11, the Congressional Budget Office said it would add about $220 billion plus to the deficit to repeal the law. No one can tell us this afternoon how much this will add to the deficit. I yield myself 10 more seconds.
The gentleman is recognized for 10 seconds.
The Congressional Budget Office has said by about July 23rd they'd be able to answer that question. But we're in a huge hurry here tonight. We have to pass this law this week because Mr. Cantor said the day of the Supreme Court decision we're going to show how bold and decisive we were. Why should Congress vote on a bill when absolutely no one knows how much it's going to cost? I've not heard that answer from the majority side.
Chairman from Minnesota is recognized.
Mr. Speaker, now I'd like to yield 1 minute to the gentleman from California, Mr. Rohrabacher.
Gentleman from California is recognized for 1 minute.
I rise in support of repeal. Mr. Speaker, when Republicans had control of Congress and the White House during the previous decade, we failed to address America's major health care problems, which were rising costs and a lack of access to health care for millions of hardworking Americans. So we Republicans didn't do the job, never passing up a chance to expand the size and power of government over our lives. The Democrats have seized upon this opportunity to change the fundamental nature of health care in America. Instead of fixing the problem, they chose to change the system. It is significant to remember that even though there were serious issues that needed attention, most Americans at that time were satisfied with their health care coverage. Nevertheless, Obamacare passed this House by 7 votes and the Senate with no votes to spare, and nobody had read the whole bill. What disturbs me most is the largest percentage of Americans who were satisfied already with their health care are going to find out to their dismay that the quality of their health care under Obamacare will go down and the cost will go up. President Obama has promised those who are content with their current coverage that they could keep it. We now know that is not true. Is my time up? I would ask that the rest of my statement be put into the record.
Without objection. Gentleman from New Jersey is recognized.
Mr. Speaker, if I may engage the chairman, we have only one speaker left on our side, and if it would be, I assume he has the right to close. So if it would be amenable to him, we're going to let him finish the rest of his speakers, and then I will close for our side, and then the chairman would close.
Do I understand that the gentleman from New Jersey is the last speaker?
That is correct.
The only speaker remaining?
The last and only.
I have 2 more speakers and myself, so
we'd be happy to yield to
them. And could I ask one more time, time remaining?
Gentleman from Minnesota has 4 minutes. Gentleman from New Jersey, 5.
Thank you, Mr. Speaker. I now yield 1 minute to the gentleman from Wisconsin, Mr. Duffy.
Gentleman from Wisconsin is recognized for 1 minute.
Thank you, Mr. Speaker. There are a number of reasons why we should all vote to repeal Obamacare. The tax increases on middle-class Americans, the debt that's going to be piled on to the next generation of Americans. But I want to talk about the impact of this legislation on our senior citizens, the impact that this legislation is going to have on Medicare. The fact that this bill takes $500 billion out of Medicare and uses that money for Obamacare. And the trustees of Medicare have indicated that Medicare goes bankrupt in 12 years. The CBO says it goes bankrupt in 8 years. Why we would take $500 billion out of Medicare for Obamacare doesn't make sense. But one of my biggest concerns is the Independent Payment Advisory Board, a board that is going to systematically look at where it can reduce reimbursements to doctors, hospitals, and clinics for Medicare reimbursements. If you reduce payments to doctors, hospitals, and clinics for seniors, you're going to impact the quality and access of care for our current seniors, not a future generation, but our current seniors. I think that's wrong. I think both parties should come together and find a bipartisan bill that will work for all Americans. I yield back.
Gentleman from Wisconsin yields back. The gentleman from New Jersey
I yield
is
myself 15 seconds.
Gentleman is recognized for 15 seconds.
Thank you. The changes in Medicare the gentleman from Wisconsin just spoke about added 8 years to life of Medicare, added benefits to Medicare, and they were so bad that he voted for them twice, that every dollar of those Medicare savings were in the last 2 Republican budgets for which he voted.
Gentleman yields back. The chairman from Minnesota is recognized.
Thank you, Mr. Speaker. I yield now 1 minute to the gentleman from Texas, Mr. Farenthold.
Gentleman from Texas is recognized for 1 minute.
Thank you, Mr. Speaker. Our job as representatives is twofold. We lead and we listen. And if we think back to the last election that swept a Republican majority in the House, a lot of the survey says that was a result of the public's dissatisfaction with this law. We voted to repeal all or parts of it multiple times, and will continue to do so. We just conducted an online poll, a mail survey, though not scientific, still showing over 79% of the folks back in South Texas opposed to this law. So I am looking forward to voting to repeal it again, as I'm sure many of my colleagues are. I do want to take a second to address something the gentleman on the other side of the aisle mentioned. We don't have a CBO score for this. Well, I would imagine the cost to the federal government, a good chunk of it, is foregone revenue in the taxes that this bill imposes. It makes no sense that undoing something actually costs the government money in the way of spending. It only costs the government in the way of foregone revenue, just like this bill has cost this economy in foregone jobs. We have numbers showing that there are thousands of jobs that could be lost as a result of this, and we have small businesses that are telling us they're not growing, they're not expanding because of the uncertainty associated with this law and the costs associated with complying with it. Thank you.
Gentleman yields back. The gentleman from New Jersey is recognized.
I yield myself 15 seconds.
The gentleman is recognized for 15 seconds.
Mr. Speaker, this is the first time, apparently, in the modern history of the Congress where we voted on a major piece of legislation and not a soul knows how much it's going to cost the federal treasury. I think that's an irregular and irresponsible procedure. I think on that basis alone people should vote against this bill. I yield back the 15 seconds.
Gentleman reserves. Gentleman from Minnesota is recognized.
Mr. Speaker, I now yield 1 minute to the gentleman from California, Mr. Royce.
Gentleman from California is recognized for 1 minute.
I thank the gentleman for yielding, and I join with those that are concerned. I urge my colleagues to repeal this health care law so that we can replace it with a plan that is fiscally responsible, that gives Americans the freedom to make health care choices for their family, that contains reforms that actually reduce costs and actually expands coverage. My concerns here are with this 150 new government agencies that we're going to see, with what I believe will eventually lead to a government takeover of health care, with the creation of a new, massive entitlement program with a cost of $1.76 trillion over the next decade. And I know the argument is made, well, we're going to pay for this by cutting Medicare by $500 billion. How could that possibly be done, given the Office of the Actuary telling us that that's not possible? That is not possible. And all of the taxes in this bill, how that will hurt business, I can tell you right now, businesses are facing an enormous amount of uncertainty, largely because of our massive debt burden. And here we've compounded that problem with 20 taxes on businesses and individuals in this law.
The gentleman from California yields back. The gentleman from New Jersey is recognized.
Mr. Speaker, I yield myself 15 seconds.
The gentleman's recognized for 15 seconds.
The $1.7 trillion cost the gentleman just mentioned is a gross cost. The last time the CBO looked at this, which was in 2011, the first of 31 attempts at repeal, they said that the net savings to the deficit would be over $200 billion. Repealing the health care bill costs the federal money treasury and adds to the deficit.
Gentleman reserves.
Gentleman ready to close?
Yes, we are. We have no other speakers, and in which case I would yield myself the balance of our time.
Gentleman is recognized for balance of time.
Mr. Speaker, I'd like to thank my colleagues on both sides for the civil and constructive tone of this debate. It's been an honor to be a part of it. I also want to note that the leader of our committee, Congressman Miller from California, is regrettably not with us because of the death of his mother. We extend our condolences to his family and certainly to our beloved colleague, George Miller. I want to speak for just a few minutes about some people who have been left out of this debate tonight. Most importantly, the people who have been left out of this debate are the people looking for a job in this country or looking to grow business in this country, because that's what we should be working on here together tonight. We should be working on legislation to put the American people back to work and create an environment where America's entrepreneurs can grow and thrive and succeed. Instead of doing that, instead of asking Speaker Boehner's infamous question, where are the jobs, we're asking, where is the 31st vote on the repeal of the health care bill? And by doing so, we're forgetting about some other people whose voices will not be heard in this hall tonight, but who need to be heard throughout this country. The person who had a malignancy in her breast when she was in her 20s, and now when she goes to start a company and get insurance in her 30s is told that we won't sell you an insurance policy because you had breast cancer, or we'll charge you 3 times what we charge someone else. That should be illegal. Under the law that the majority is going to repeal today, it is. We ought to be hearing from the family whose son or daughter graduated from college and is still working as a substitute teacher or still going to grad school part-time, who has health insurance today because the law says they can stay on their mother or father's policy. That should be the law. And under the law the majority wants to repeal today, those families would lose that benefit. We ought to be hearing from the senior citizen who has to choose between paying their prescription drug bill or their utility bill at a time of a heat wave or a cold snap. They ought to be in a situation where the Medicare program helps to make those prescription drugs affordable. And under this law that the majority wants to appeal today, that senior is getting between $600 and $800 a year of a rebate. We ought to be thinking about the family who has suffered the tragedy of a malignancy for a child in their family. And the child hits their millionth dollar of chemotherapy, and the insurance company says, we're sorry, we're not insuring you anymore. We're not paying the bill anymore. That ought to be illegal, and it is illegal under the Affordable Care Act. But if the majority succeeds in its repeal, that will no longer be the case. You've heard a lot of things today about what this bill isn't. It isn't a $500 billion cut in Medicare. It expands Medicare benefits. It lengthens the Medicare trust. It does so by cutting out corporate welfare for health insurance companies. And every single Republican speaker here today voted for every one of those cuts in the last 2 Republican budgets. It's not the largest tax increase in American history. 97% of American families don't pay $1 more in taxes under this bill. If your family has a gross income above about $300,000, yes, you do. But for the other 97% of American families, that's not the case. We've heard this is a government takeover of health care. This is a consumer takeover of health care. It's a law that says when your insurance company says to you, sorry, but you had breast cancer, we won't insure you, you don't have to take that anymore. When your insurance company says, we're sorry your daughter has leukemia, but we're not paying her bills anymore, even though you paid your premiums for 20 years, you don't have to take that anymore. It says when the insurance company says, here's a bill that's 40% higher because you're a woman, you don't have to take that anymore. This is not about defending a statute. It's about defending the rights of middle-class Americans who deserve better than this repeal. We should defeat this repeal and come right back to work tomorrow on a bill that will stop outsourcing and support insourcing of American jobs. It's time to get back to work, putting America back to work, and end the 31st travesty of trying to repeal this bill. Vote no.
Yields. The gentleman from Minnesota is recognized.
Thank you, Mr. Speaker. I yield myself the balance of our time. Mr. Speaker, we've heard a lot of the same debate, the same rhetoric we heard before this bill was turned into law, passed on Christmas Eve, jammed through Congress. Now we've had a chance to look at the results of that law. The reality includes higher health care costs, fewer jobs, and even more government meddling in health care decisions of private citizens. We've now had over 12,000 pages of regulations and are still writing them. It's no wonder that America, American employers, American employees, American families are afraid of what's next. We've heard on this floor today a suggestion that everybody should be in Medicare. No wonder they're afraid. We've heard about millions of new jobs added, and yet we're in the most anemic recovery since World War II. We need jobs. We need to get Americans back to work, and we believe that the first important step to helping those employers put Americans back to work is to repeal this awful law. I urge all my colleagues to vote yes on repeal of Obamacare so we can stop debating a failed law and start advancing real common sense health care reforms. I yield back.
Gentleman yields. The gentleman from Wisconsin is recognized for 15 minutes.
Mr. Speaker, I yield myself such time as I may consume.
Gentleman is recognized.
At this time, I would like to yield myself 1 minute.
Gentleman is recognized for 1 minute.
Let me say it this way, Mr. Speaker. This bill barely passed into law. It was the biggest social legislation to pass into law in over 40 years. 7 votes in the House, no votes to spare in the Senate, Christmas Eve, backroom deal, and it was based on 3 promises by the President of the United States. 1, if you like the health insurance you have, you can keep it. That's a broken promise. 2, this will bring down our health care premiums. That's a broken promise. 3, there's no tax on people making less than $200,000 in this bill. That's a broken promise. Well, the President said to get it passed there was no tax. Then he sent his lawyer to the Supreme Court to argue that it was a tax so he can keep it on the books. If any of these 3 broken promises were known to the public and to Congress at the time they were passing this law would never have passed in the first place. We now have this information. Let's revisit this. And with that, I look forward to a hearty debate with my good friend from Maryland, Mr. Van Hollen, and I'll reserve the balance of my time.
Gentleman reserves. Gentleman from Maryland is recognized for 15 minutes.
Thank you, Mr. Speaker. I yield myself 1 minute.
Gentleman is recognized for 1 minute.
Thank you, Mr. Speaker. What we're engaged here in the House of Representatives right now is a total waste of taxpayer money. It's no wonder the American people think so little of this institution. We are now on our 31st effort in this House to repeal all or part of Obamacare. We have not yet voted once on the President's jobs bill, which he presented last September. Two numbers: 31, that's the number of times this House will now have voted to repeal Obamacare. 0, the number of times that we voted on the President's jobs bill. I've been listening to this debate this afternoon, and we've heard the same old, tired misrepresentations and distortions that we heard the first time around. Government takeover of health care. In the year 2010, PolitiFact rated that the lie of the year. And it just goes on and on and on like whack-a-mole. You know, the American people do not want to relitigate this issue. What the American people want us to do is focus on jobs in the economy. Let's get on with that business. I reserve the balance of my time.
Gentleman reserves. Chairman from Wisconsin is recognized.
Mr. Speaker, I'd like to yield 1.5 minutes to the distinguished gentleman from Texas, a member of the Budget Committee, Mr. Flores.
Gentleman from Texas is recognized for 1.5 minutes.
Mr. Speaker, I rise in support of the repeal of Obamacare Act. The original Obamacare Act, which was passed in the middle of the night by the last Congress without being read, has numerous fatal flaws. One, the worst of these is that it is a violation of our constitutional liberties. Two, it fails upon its primary goals of controlling costs and allowing Americans to keep their current health insurance coverage. Three, it hurts our hardworking taxpayers by adding over 20 new taxes costing over $800 billion. Four, according to the non-partisan Congressional Budget Office, the CBO, it will cost our nation's workers over 800,000 jobs. Five, in addition, now that the state Medicaid mandate has been ruled unconstitutional, those costs will increase by several $100 billion over its already massive cost. Six, Obamacare puts 15 unelected, unaccountable federal bureaucrats between Americans and their health care providers. Seven, even though just partially implemented, it has caused health care insurance premiums across the country to increase dramatically. And eight, last but not least, Obamacare is causing massive uncertainty for American businesses, hurting American job growth and our economy, and the American middle class, adding pain to an already troubled Obama economy. Mr. Speaker, in light of these many flaws, it is time for Congress to do the right thing and to repeal this fatally flawed legislation. That is what H.R. 6079 does, simply put, and I urge my colleagues to support it. Thank you. I yield back.
The gentleman from Texas yields back. The gentleman from Maryland is recognized.
The gentleman from Maryland, I understand, has just like 3 or 4 speakers, correct?
About 5 or 6.
5 or 6. I'll let you go there.
Mr. Speaker, you know, it's quite a scene to see so many of our colleagues rush to the floor of this House to call upon this Congress to deny the American people health care protections, patient protections that every member of this Congress has. If the child of a member of this Congress has pre-existing conditions, whether it's diabetes, whether it's asthma, their child gets covered. If their child is 25 years old and didn't happen to have health insurance, they can be covered on the health insurance plan. And yet this bill to repeal Obamacare would deny to the American people the same kind of patient protections that every member of this Congress enjoys. It's a sad day. With that, I yield 1.5 minutes to the gentlelady from Pennsylvania, Ms. Schwartz.
Gentlelady from Pennsylvania is recognized for 1.5 minutes.
Thank you. I appreciate the opportunity to speak on this legislation. As so many of us know, 2 weeks ago, the Supreme Court upheld the Affordable Care Act. affirming the path forward to those consumer protections and to increase access to affordable health insurance coverage, for seniors to afford life-saving medications, for children, 17 million American children who have pre-existing conditions to receive coverage for the care that they need, for 30 million uninsured Americans to be able to afford coverage. Because of the Affordable Care Act, families will not go broke because of an illness. Small businesses can afford affordable coverage for their employees, and young adults, 6.6 million of them, can remain on their parents' insurance. Yet Republicans are continuing their politically motivated attempts to repeal health care reform, instead of working to grow our economy and strengthen the financial security of America's middle class. Today is the 31st time Republicans have called for a vote to deny Americans access to affordable, quality health coverage. This legislation reflects a clear decision by Republicans to put partisanship ahead of the pressing needs of our constituents and our country. Their actions are taking time and attention away from the work we should be doing. It's wasteful and it's misguided. Their actions are creating uncertainty and hurting our economic recovery and the security of middle-class Americans. I urge my colleagues to oppose this legislation and get to work on jobs and economic growth for our families, for businesses, and for our nation, and stop this wasteful, unnecessary action. And I yield.
Gentlelady from PA yields back. The chairman from Wisconsin is recognized.
Mr. Speaker, I'd like to yield 1 minute to the gentleman from Oklahoma, distinguished member of the Budget Committee, Mr. Cole.
Gentleman from Oklahoma is recognized for 1 minute.
I thank the gentleman for yielding, and I thank the Speaker. Mr. Speaker, Obamacare is unpopular, unworkable, unaffordable. Unpopular because it limits individual freedom and personal choice. Unworkable because it relies on thousands of regulations, dozens of boards and commissions, and an unelected group of bureaucrats to distribute and ration care. We have the opportunity today to end a bill that's also unaffordable. Hundreds of billions of dollars worth of taxes, hundreds of billions of dollars worth of raids on the Medicare fund. We can only take the first step here today, but in November, the American people can take the next step by electing a president and a Senate that will work with this House instead of against them to repeal what's a legislative monstrosity that should have never passed in the first place. With that, I yield back.
Gentleman from Oklahoma yields back. Gentleman from Maryland.
Mr. Speaker, the gentleman who just spoke, the gentleman from Oklahoma, called this bill unaffordable. We heard the debate a little bit earlier about what the nonpartisan Congressional Budget Office has said about this bill, the Affordable Care Act, and they say if you repeal the Affordable Care Act, it will increase the deficit over the next 10 years, and it will increase it by over $1 trillion in the second 10 years. And yet we have this bill on the floor today without even a fresh Congressional Budget Office estimate. So nobody knows how those numbers may or may not change. But we do know is that the last assessment they gave us was that the action that our Republican colleagues are proposing today would increase our national deficit. That is not fiscal responsibility. And with that, I yield to the gentlelady from Minnesota, Ms. McCollum, a member of the Budget Committee.
Thank you.
How much time?
I yield a minute and a half.
Thank you, Mr.
Gentlelady
Speaker.
is recognized for a minute and a half.
Mr. Speaker, thank you, Mr. Van Hollen. This Republican Tea Party Congress is wasting America's time promoting the only issue they care about, their re-election. Today's vote is not about health care. It's a gimmick to pander to the Tea Party. This bill shows the Republican vision for health care. It's deny coverage, deny care, deny the law of the land. If you have a child with a pre-existing condition, possibly a life-threatening illness, this Republican plan means your child's health care insurance can be terminated. If you're a senior on Medicare, this Republican plan throws you back into the donut hole. The Republican plan repeals the Indian Health Care Improvement Act, harming Native children, families, and seniors all across Indian country. The Affordable Care Act is the constitutional law of the land, and it is a good law because Obama does care. President Obama and Democrats must continue to work to implement the law, extend the quality, affordability of health care to millions of Americans, and this Congress must get back to work, putting America back to work. With that, I yield back.
Gentlelady from Minnesota yields back. The chairman from Wisconsin is recognized.
Mr. Speaker, let me yield myself 30 seconds to simply comment. We know the CBO is going to give us a score perhaps in a couple of weeks, and it's going to be more expensive. That much we know. We know states will probably put more people on Obamacare instead of Medicaid, which will cost more dollars. The only reason this bill, quote-unquote, on paper saves money is because they told CBO to score 10 years of tax increases of Medicare savings to pay for 6 years of spending. You can contort and distort and torture statistics long enough, and eventually they'll confess. That's what happened here. In reality, I have no doubt that this will be a budget buster. And with that, I'd like to yield 1 minute to the distinguished member of the Budget Committee, a gentleman from California, Mr. McClintock.
Gentleman from California is recognized for 1 minute.
I thank the gentleman for yielding. Chairman Ryan noted the false claims upon which Obamacare was sold to the Congress, and I think they bear elaboration.